Hey, gang.
It is for entertainment and basic informational purposes only, and is solely responsible for its content.
Yeah, just had to make sure to get you there.
Its management or its staff. News Talk 630 and 99.7 FM WPRO presents Intellectual.
Okay. Hi, everybody. I hope this is working. I'm operating without Shannon today, so, technology's all in my hands. That's a scary thought. Good morning, everybody. It's Dr. Petteruti from Intellectual Medicine. I'm back after a week off. Thank you to Dr. Michael Souza for doing a fantastic job. A brilliant, dedicated, and creative physician who practices intellectual medicine at an extraordinarily high level. Today, people, it's an important show. Get out your pens because I'm going to tell you the drugs you should consider stopping in 2019. There's at least 10 of them of little to no merit that can cause harm. And I'm going to answer this question. Suppose you went to your doctor and the doctor said, your blood pressure is 155/98. And told you that on follow-up visit, the same blood pressure. Tyler, if you heard that number, Tyler's a young, healthy guy in the prime of his life, healthy-ish, 155/98, that's your blood pressure. The doctor says, you're going to be okay, you don't need any treatment. How'd you feel about that? That is a brilliant answer, my friend. Pretty high number, right? So should you get that number treated? Well, we're going to reflect on that. There's a study that sheds enormous light on that topic. And then, this might be the most important thing we talk about, well, maybe all year. And it is the nature, the essence, and the substance of evidence itself. What is evidence? We hear a lot in medicine about evidence-based medicine. Well, that sounds good, doesn't it? I mean, hell, I want evidence for my medicine. We all do. But it makes it seem as if there's a yes-no, like a toggle, where you can have a flow chart that says, if X occurs, you do Y, because that's evidence-based. Well, there was a fascinating study looking at the nature of studies. That seems weird, a study about studies, but I'm going to describe it to you and explain why evidence-based medicine can be a detriment to good medical care when it is misapplied, which in the view of intellectual medicine often happens. Really? Think about that. How many times does a patient describe how they're feeling, what's going on in their body, and that impression gets diminished in the weighing of decision making? So I can give you an example. Somebody comes in feeling tired and run down. The evidence doesn't support, fill in the blank, treating that. What about replacing their hormones? What about treating it with thyroid medicine, off-label use because of symptoms that are reflective of inadequate levels? We know the symptoms define the patient's condition and are the most important element to weigh. And they are also the most important things to objectively quantify. It's not evidence. It's just one patient. We've heard this before. It's anecdotal. It's one patient. There's no evidence that giving high-dose vitamin C is going to prevent cancer nor aid in patients recovering from it. And if a patient does well, as frequently occurs, well, it's not really evidence. You see, it's just one case. Then the cry comes up, we need a study. So the study happens, and then the interpretation gets muddled, and there's still no evidence. We've heard this about supplements. We've heard this about nutritional interventions. No evidence. There's no evidence supporting. Well, Orthodox medicine, they like their pills. They like their surgery. They don't like naturopaths. They don't like nutritional medicine. By and large, there are some exceptions. There are pockets of intellectual medicine exist everywhere. Sad to say, they're evaporating. And the medical system is splitting into two large spheres, right? there is vertically integrated corporate medicine that is dominating, and vertically integrated corporate medicine likes flowcharts. And you ever noticed you go to the doctor nowadays, and often it seems like there's a preset agenda that had nothing to do with why you showed up. And that agenda has to do with what things are being monitored. Your immunizations, your mammograms, your statin drugs. Well, do you know from 1997 until 2012, the rate of polypharmacy, that's multiple drugs being used, has gone up from 17 to 60% in the elderly population, older people. 60%. You ask them what drugs are on, their eyes glass over. I don't know. I line them up every morning and I take them. There's a reason why you're on too many drugs, and I'm going to explain that reason. It has to do with psychology. It has to do with mortality. It has to do with incentives and money. So we need to get all that. I also, though, I got to give, the elections are over, so I'm calling a truce. This should be a political truce where we just stop politicking for a little while, and we thank the people that were willing to run. It's an unpleasant pursuit, and we thank the people who are willing to serve, even if we don't agree with their political persuasions or their particular agendas. So I'm calling a truce. We should have a moment of quiet as we focus on pulling together. All right, truce is over. Okay, now we can go back to debating. Really, so Rhode Island voted in favor of more of the same, more high taxes, more corporate giveaways, and what a shock, now Hasbro might be leaving. In the last several years, Rhode Island has had incremental improvement, really fractional when you compare it to what's happening nationally. We still have 20% of our population on welfare. We still have underemployment with regard to quality and income. And, I hope I'm wrong about this. It was Margaret Thatcher who famously said, socialists end up running out of spending other people's money. In Rhode Island, how much more money are we going to give away to try to get people to come here? Is this a recipe for winning the day? How many more businesses are we going to watch close, leave, or vacate the premise? And we get a headline because we've corralled one business to come here. Rhode Island lives and dies on the grassroots people that are here every day grinding a living in small and micro businesses. We do not thrive by trying to throw money at corporations that have no tie to the area. The best way for long-term sustainable growth is to simply make this environment more appealing to people that want to start and grow businesses. Intellectual medicine added 6 employees over the past year, all high-paying jobs, 0 subsidies. Now, if we were big enough, we might have to look at other states, right? Because this state, I love it here, we'd probably stick around, but the taxes do not make it appealing. It's the ties that bind. Alex and Ani are here, not because we gave them money to come here, because they grew up here. We need to stop this nonsense of throwing money at companies that really don't like us, but they're just taking our cheese. Anyhow, when I come back, we're going to talk about the drugs you should not be on, and I'm going to explain how it happened, why every time you go to the doctor, you get drugs added, but almost never deleted. And we're going to answer, Tyler, we're going to answer that blood pressure question as well. Should you or should you not take blood pressure drugs? And we're going to tell you about the connection between marijuana and youthful brains. Is it something that may blunt intellect? I'm Dr. Steve Petteruti. This is Intellectual Medicine. You're listening to WPRO. We'll be right back. Hey, team. Shannon's not here today, so I can't interact with you guys like we might normally when she's texting stuff. So I just trying to read what's there. So maybe, I'll tell you this. Any messages or questions that you guys send in on the Facebook page while we're chatting, I will take the time to answer after the show, so let's stay engaged. But yeah, polypharmacy is a horrible scourge on healthcare. Modern medicine is one of the most dangerous things you could do for your health. Going to the hospital is a scary proposition. Things have gotten more dangerous out there. If it were listed as a cause of death, Interaction with modern healthcare would be one of the top 5 causes of death. Going to a hospital is hazardous to your health. Anytime you can avoid it, you should. Elective surgery should be contemplated. You should get at least 3 opinions before you get your back operated on, your knee operated on, before you get a joint replacement, before you do any surgery that is not a critical matter of life and death in the near term. I would say that's even true for cancer surgery. Look, when you get diagnosed with cancer, it's a terrifying moment. And many times there's an urgency to get stuff done. I want that cancer out of me now. Pause. Get multiple opinions. It won't matter to your outcome if you get it operated on next week or next month. In most cases, there are rare instances where surgery is a critical urgency due to life-threatening symptoms. I get that. But for many of us, let's take for instance, you have breast cancer. There's a tumor in your breast. It's a horrifying moment. Every woman's nightmare, one of them. Get multiple opinions. Talk to the surgeons. Ask them how they plan to treat this. And trust your instincts. You know, Gestalt is that sense you get, that vibe you get when you enter a facility. So I had a patient of mine recently diagnosed with breast cancer. She went to multiple surgeons at my encouragement. And you know, one of them, she called, never got back to her. The next place she called, bang, they were on it. The next day, everything's set up. And you know who was on it like that? It was Mass General Hospital. You wouldn't think so. You wouldn't think that the big hospital like that would be so patient-centered. But in this instance, they were. You know, Rhode Island is a small state, and we have some of the world's best surgeons and doctors here. However, we can reach out to a wider area whenever we need to. I'll tell you about the guy who went to Florida to get his knee assessed in a moment.
Now back to Intellectual Medicine with Dr. Petteruti. Call in now at 438-WPRO or 1-800-321-WPRO.
We are back. It's Dr. Petteruti here at Intellectual Medicine. And yes, people, that sound you're not hearing is the sound of Shannon not here this morning. She had work to do that didn't entail being on the radio. So I get to sit here and blather on the radio while Shannon is busy at home. So this is a cute story, Tyler. My stepson got a job at Dave's Marketplace. Kudos to him. Not an easy thing to do. Dave's is a very demanding employer. And, Ethan is a fantastic employee. He's a high energy, smiling, good kid. So he came home from work the first day, and he said to us, "Did you know the government gives away free food? People get free food?" He was stunned. He said, "How do I get that? How am I going to get free food?" He was just, it was funny, right? Because childhood perspective. In this year, $70 billion will go to the food stamp program called SNAP, or Supplemental Nutritional Program. 10% of that $7 billion will be spent on Coca-Cola, Mountain Dew, and other sugary drinks. Tyler, I don't know about you, I'm an empathic American. There's not an American that should go to bed hungry. And the SNAP program started in the 1960s, was meant to address caloric deprivation. I can't imagine that there's a famine in Somalia and you see the trucks backing up and they're offloading Mountain Dew. I don't see that picture happening in anybody's perspective of caring for the hungry. It's not, you know what it is? Here's my take, folks. You should have, here's what I would do if I were king of the world. And by the way, if you guys want to nominate me for that position, I might consider it. I would have in every supermarket free food. You could get staple food. You get a 5-pound bag of potatoes, a 5-pound bag of rice. You could get maybe 10 things that are available to any American, no question asked. It would be an honor system. You know, if you can afford to buy the food, please buy it. If not, we don't want anybody to go hungry. Here are your staple foods. Everything else you got to pay for. And then, yeah, would there be some graft? Would some people steal the free rice? I suppose. But boy, nobody could ever say I'm going hungry. because you would have the basics addressed. That's my idea. I don't know, $7 billion for Coca-Cola doesn't exactly stir my pulse. And now we've got an epidemic. Yeah, we've got this epidemic of obesity, right? I got to tell you, so the epidemic of obesity is being propagated by a lot of misinformation. The notion that people carrying excess weight are lazy or ignorant is pervasive. At Intellectual Medicine, we have figured this out along with other colleagues who are studying obesity as a serious medical, social, and physiologic phenomenon. So I had this patient who came to me. I got to share this story, folks, because it's a little bit heart-wrenching and it's also enlightening. And lifetime challenges with weight. In her teens, she went to TOPS, Taking Off Pounds Sensibly. Good name, right? Nice acronym. Sensibly. Who'd be opposed to sensible? Well, at our first meeting as a kid, when you went to these meetings, they would clap for you, yay, if you lost weight, right? They'd applaud you because that meant you're good. And if you lost the most weight, you got to be queen of the day. And if you gained weight, you know what they did? Just think what they would oink at you. They would make oinking sounds and point at the kid who had gained weight. How awful. And unfortunately, we're still doing that to a large extent. We're still oinking at people. We're still acting like they're ignorant or lazy. Folks, if you're listening to me and you've battled weight, this is a metabolic problem. It is a neurotransmitter phenomenon. Those fat cells can take over function of your brain. You need help with this. Dr. Souza, Intellectual Medicine, Providence, Warwick, we've got this down. You come see us. This has to be one of the most important things we can do for our health. Now we got to talk about polypharmacy, though, because I promised you I would. So here we go. You go to see the doctor. You have a problem. The doctor puts you on a drug. You go to see another doctor with a different problem. The doctor puts you on a drug. 5, 6, 7, 8 years go by, maybe 10. You end up on about a dozen drugs. And now here's why doctors put you on drugs and hardly ever take you off of them. And it has to do with the phenomenon of inevitability, right? Inevitably, everybody gets sick and dies. I mean, that's 100%. Everybody's going to die. Well, if I'm a doctor and you're on 12 medicines and I take you off a drug and coincidentally you happen to have a bad event, I'm going to get blamed. Subconsciously, this is one of the doctor concerns. Even when the evidence supports taking you off the drug, even when the drug has little to no merit, coming off of it makes doctors uncomfortable, especially in this era where it seems like nobody has an authoritative family doc, or they're uncommon. Family doctors have been beaten into submission by and large, and they're afraid to muck with a drug prescribed by a specialist. So you end up on a dozen drugs, and nobody's got the guts to say to you, you know, maybe you don't need that one. Maybe you can come off of it. So you, my dear listener, you have to be assertive in your health care. And I'm going to give you this list. You're going to get these drugs. It doesn't mean you go to your cabinet and say, Dr. Petteruti on the radio told me not to take this, and you throw it in the trash. Please don't do that. Go to your doctor and say, Doctor, I've heard that this drug may not be necessary. Can I come off it? I would like to. You can change the environment in the clinic, in the office, by virtue of how you frame it, right? Absolutely. So doctors are afraid to take you off the drug. There's a risk of being blamed for bad events. People generally not you. My listeners are more sophisticated than the average, right? I give you guys kudos. Merely by listening to this show, your IQ goes up. Studies have shown it goes up 3 points per radio show. All right, that was a joke. Please take a deep breath, everybody. But we have the smartest listeners on the radio, I believe. I believe that to be true. Anyhow, so you're assertive in your healthcare. You go in there and you say, listen, let's get off some of these drugs. Now, which ones should you get off of? How about proton pump inhibitors? You know those antacid drugs that are so popular now? Hey, I can eat anything I want. I can eat crap food and take this little pill. Oh, my Lord, what a horrible idea. You get to take a pill that enables you to eat poorly. Look, the body is engineered pretty well. And heartburn is a warning sign that something's out of whack. It's not a symptom that should be obliterated. Taking a proton pump inhibitor like Prilosec, like omeprazole, to try to get rid of a heartburn symptom, it's like getting stuck with a knife and taking opium to make the pain go away rather than address the fact that you're stuck with a knife. There's a reason for the heartburn. It needs to be figured out, and you need to get off the drug. All right, my next drug I love to hate. How about statin drugs? If you've never had a heart attack and you're not a diabetic, and your doctor wants to put you on Lipitor because your cholesterol is high, whoa, that's a big yield sign, people. There's little to no evidence it'll do you any good. There is compelling evidence that it'll cost you a lot of money, or the healthcare industry. This is a multi-billion-dollar prescription. Imagine you're 45 and your doctor said you have high cholesterol and you got to go get it treated. Well, that's about a 40 to 50-year prescription. For what benefit? Dr. Souza was talking the other week about the Boston Heart Test. The Boston Heart Test is a more sophisticated way to analyze cholesterol and its risk. And you should request it from your doctor. It's not insurance covered. It's cheap. Costs maybe $100. Get your Boston Heart Test and get that analyzed in more detail. How about this one? So I asked this question to a patient recently. I said, do you have any problems with sleep? The patient said to me, no, I have no problem at all. I take this pill every night. I go right to sleep. I go, what? That tells me you have horrible problems with your sleep, right? Right? You should not need to take a pill to go to sleep. This is like taking a pill so that you can eat food, right? This is an essential human function. And taking a drug to help an essential human function is a red flag. What do we know about sleeping pills? They increase your hazard ratio. Everything from dementia to falling. Not to mention the degradation that occurs. You know, they did a study once looking at a sleeping pill compared to no sleeping pill. And they found on average that when you took the drug was Zolpidem, also known as Ambien. And guess how much longer the people who took the drug slept per night, Tyler? 10 minutes, 1 hour, or 3 hours? You will, because I led you down that path. You're a smart guy. I'll bet you did well on your SATs. But 10 minutes is correct answer. 10 minutes. You know what happened, though? They woke up just as much. They forgot they woke up. So when they got up in the morning, they said, yeah, I didn't wake up at all. It was a great night's sleep. But for some odd reason, I still feel crappy. Yeah, because your quality of sleep was terrible. And you didn't get growth hormone. And you didn't regenerate. There's a better way, intellectual medicine way. I have more of these to go over, but I know we're running up against the clock. I'm going to tell you about more drugs that you should consider coming off of. And then we need to talk about the nature of evidence and the blood pressure question of the day. If your blood pressure is 155/98, should you take a drug? I'm Dr. Petteruti. This is Intellectual Medicine, and we'll be right back. But first, from the Revolution Southwest News Center, it's Doug Lizette with today's headlines. Hey, Doug.
Thank you, Doctor. The White House is calling off President Trump's scheduled visit to a World War I cemetery due to poor...
Almost forgot that one. Introducing Doug Lizette. He's such a good guy. He's got a nice voice. So this is Veterans Day weekend. I remember when I was in the Army, I was in ROTC back in the 70s. We used to have to hide our uniform. We weren't allowed to wear it on campus because we were afraid that we get attacked by our fellow students because they didn't like what they perceived we stood for. It was at Tufts University. It was a hotbed of anti-militarism. And I know stories of older colleagues in the military that came back from Vietnam. The first thing they did before they left the airport was get rid of the uniform. They couldn't be seen in it. Why? Because they didn't like what it stood for? Because somehow it represented a political persuasion they didn't like? Well, fortunately, at least in this moment, we're not doing that to military people, but we are doing it to people of political persuasions that we don't like, right? People are being assaulted in their homes, at restaurants. People are being aggressively attacked on personal levels because they like or don't like a certain political character or player. This is not right. We need to be able to have thoughtful debates. We've become a society of rock throwers. You don't like what I say? Then you must be an idiot. You don't like intellectual medicine? You think what I say is bogus? well, then we're going to throw a rock at you. So we need to put the rocks down. We need to pick up our books. We need to pick up our history lessons. And we need to be more tempered in the way we have discourse. Don't kid yourselves. We had one civil war in this nation. Doesn't mean it can never happen again. So kudos to veterans. You know what? When you sign up to join the military, you sign up saying that I will surrender my life if I need to in defense of my country. I will surrender my life if I need to, even if the cause I'm fighting for isn't one that I politically concur with. Because, you know, when you're a soldier, when you're a sailor, when you're an airman, you don't get a policy input moment. You get an order and you execute it. So you think about our duty to serve, and you think about the responsibility to pull together, you know, for common cause. In medicine, it's our responsibility to be accountable to our patients. First, second, third, fourth, all the time. We're not accountable to the organization that employs us. We're not accountable to the medical establishment. We're accountable to our patient. Unfortunately, our capacity to perform that accountability duty is diluted. They've separated doctors from patients, and they've interposed third parties, insurance companies, corporations, employers, even the overzealous regulation by some departments of health and some government entities. They're really stripping doctors of freedom of thought in some cases. If you don't think correctly, there could be a negative consequence coming your way. Trust me, I've seen it happen. The insurance companies monitor doctor behavior. And if the doctor behavior does not conform to their perception of good medicine, the doctor faces censure. Suppose as a doctor, you don't feel that statin drugs have significant merit. Suppose you find that they cause side effects and you want to try an alternative approach. You're going to be censured. Suppose as a doctor you feel that for many of your patients, immunizations are not the right thing to do. You're going to be censured, even if those patients are thriving. It's a weird place. Got to get back to those drugs too, and we're going to talk about hospital grades. They came out with hospital grades for Rhode Island. We'll talk about those too. Did your hospital get an A, a B, or a C, or maybe a D? How about this? All right, so we're talking about now. How about this? How about hospitals get an A or an F? Do you really want to go to a C-minus hospital? Does this make any sense to anybody? Shouldn't it be really a pass-fail grade? At Intellectual Medicine, we have a philosophy regarding our staff and ourselves. You get 2 grades, really, in Intellectual Medicine, really 2 grades in medicine. You get an A or you get an F. Either you're great and aspiring to be great, not perfect, mind you, but great. Why? Because people's lives are at stake, because they depend on it. We can't be C workers. Look, if you want to be a C worker, I don't know, building a house, that's not great. The house won't be great. But unless it collapses, nobody's going to die. Speaking of C, I had to tell that story about my son and when the folks were smoking marijuana on the job. I'll tell that when we go back on air. It'll be just a few seconds here. So, big day for sports. It's a big day for sports. Oh, wait, we got this coming up.
That's Auto Rust Tech, 944-4444. Try to forget that phone number. Now, back to Intellectual Medicine with Dr. Petteruti. Call in now at 438-WPRO or 1-800-321-WPRO.
Hey, gang, I am back. It's Dr. Petteruti. No, Tyler, it's a very good day. It's a very good day to be me today. Do you know why? It's a good day. I love cake's great. It always makes me happy. But it's a great day. So my stepson is working at Dave's as we speak. I really am proud of the kid. It's gets up 8 o'clock in the morning, grumbles about having to pay taxes, and goes to work. It's very cool. Very adult. My other boy Owen, he's at his high speed lacrosse practice, and later today I get to go watch East Greenwich football play Burrillville in the state semifinal, where my son's going to be playing outside linebacker. And last week in the quarterfinal game, he had a high school dreamer's dream come true. In a 3-0 game, he had a pick six, intercept in the flat, running in for a touchdown. I told him after the game, you will talk about that when you're 92. So some highlight moments that anybody that's an athlete can appreciate. The game-winning shot, the game-winning touchdown, those are celebratory moments. They make us feel full of joy. And that's a great piece of life, that intellectual medicine. We want you to have those pick six moments all the time. I had a patient in this week, 10 years feeling tired, 10 years feeling run down, told, you're getting older. It's just, there's nothing wrong with you. This is just the way it goes. If you don't like the ground you're standing on, and if you're not being told anything inspiring, you need to reconsider the advice being given. I told you before you do any elective surgery, get 3 opinions. Before you accept as a fact that your condition, your status, your health, your vitality, the actual dynamic of aging itself has to be tolerated without intervention, talk to at least 3 sources of healthcare guidance, one of which I would argue should be an intellectual medicine type clinician or doctor. Aging is no longer a passive exercise, people. You're living in the era where aging itself can be addressed, the causes of it, the symptoms of it. You no longer have to wither, shrink, dry up, lose your mental edge. Oh, I had a senior moment. What the hell is that? Senior moment. No, that's scary. My brain ain't working right. Well, you know who else's brain ain't working right? High school kids on marijuana. So my son, when he was my oldest boy, he's now 33, came home from work one day, and he goes, Dad, every day at lunch, all the guys at work, he was in a construction job at the time, they go behind the dumpster and they smoke marijuana. And he's going, well, what do you do? He said, I just kind of sweep, wait for the lunch break to be over. And then he said to me, but this tells me a couple of things. Number one, I know why a lot of the houses are crooked. Number two, if this is my competition in life, I think I'm going to do okay. Now, what they found is when high school kids smoke marijuana, their ability to learn and their memory declines. And when they quit smoking for a week, it improves. Well, that's not shocking. We know that adolescent brains develop and are still changing up until the mid-20s. So when I'm talking about drugs to get rid of, kids, if you're listening to me, and you're probably not, but if your parents are, it's not a good time to start experimenting with marijuana. Let's wait on that action. And it's a horrible time to be smoking a Juul. Let's wait on that action like forever. But back to the Polypharmacy. I got to finish this story, and then we'll get to the blood pressure one. We talked about, how about beta blockers, metoprolol, Lopressor? These are drugs. When I was going through medical school, you weren't cool if you couldn't name at least 10 of them. And they became associated with protecting the heart. So after a heart attack, we'd prescribe the drug, and we all felt we were doing good. Well, it turns out we were having no real impact. And that for the overwhelming majority of people, beta blockers cause fatigue, sexual dysfunction, weight gain, and offer no medical advantage. The studies support that what I just said. How about asthma drugs? 1/3 of the people on asthma drugs do not have asthma. It's being prescribed because of wheezing, shortness of breath, coughing, with no evidence of benefit, no evidence even of the disease being present. If you're being treated for asthma, you must have spirometry to validate the diagnosis and the benefit of treatment. Think about some of the things we've talked about so far, people, right? Drugs for acid reflux, drugs for cholesterol, drugs for sleep, drugs for blood pressure, drugs for asthma. What are we doing? We're treating symptoms. We're playing whack-a-mole. We're piling up drugs. Let's get to health. There's a common denominator. underneath all of this. It's obesity. It's loss of hormonal support affecting sleep and energy. It's loss of vitality. It is failure to address the things that will keep arteries young so you don't need statin drugs. These are the focus areas. This is intellectual medicine. This is modern anti-aging therapy. Do you want to live to be 120? Well, hell yeah, if I can get there. Are you going to get there? I'm not sure. But you know what? If you don't start out with an optimistic perspective, if we do not start out with a target, we'll never get there. It's self-fulfilling prophecies, right? You're familiar with that concept, Tyler, right? Absolutely. It's powerful medicine. Look, if I tell you that you're going to live to be 75 and before that you're going to wither and get a little tired, it's very likely that that will happen because you and I will start to take decisions that are consistent with that outcome. Suppose I say, I expect you at age 100 be driving your car, going to the gym, making love to your spouse, clear-minded, strong-boned, strong-muscled. Well, let's make that the new expectation. Every time I see somebody huddled in a walker, my heart breaks a little bit. What can we do to stop this from happening? On to the drugs. How about drugs for urinary incontinence? Great. They increase your risk of dementia. They don't work that great. They increase your risk of falling. These drugs are horrible. Many, many women suffer this consequence. It tends to get worse as we age, and it tends to be from muscle failure, the muscles that hold everything in. And what makes muscles strong? Hormone therapy, micronutritional support. We've had at Intellectual Medicine many patients reverse urinary incontinence through this type of an approach, integrating weight loss with hormone support, with micronutrient support. Here's the last one, and then when we come back, Tyler, we're going to answer that vexing question that's on people's mind about blood pressure. Should you or should you not go on a blood pressure drug if your blood pressure is 155/98? But the last drug to not take, Alzheimer's drugs, dementia drugs. They don't work. Unfortunately, dementia is largely an environmental phenomenon where things unravel quickly over time at the end of a lifetime of brain insults. Well, when we come back, we're going to talk more about the blood pressure issue and from the vitamin D fronts, the winter's coming. Would vitamin D help prevent depression? Answers to that and more of your burning questions when we come back. This is Intellectual Medicine. You're listening to WPRO. So many topics, so little time. So I'm sitting here and I'm giving my radio show, and in the background there's a TV screen. And on the TV screen comes an ad for CoolSculpting, which is enormously popular right now, where you're going to freeze that fat off, right? Sounds great, doesn't it? Just go in there, you spend a few $1,000s, you go in the freezing machine and watch your fat fall off. How absurd, how fruitless, how temporary, and how expensive. So here's the reality, people. Yes, you can freeze off some fat a little bit. Yes, you can see the impact of that in the months to follow. But the fat's coming back, folks. There's nothing you did to change anything about how you eat, how you live, how your hormones work, how your metabolisms work. So you're simply going to redeposit that fat at a later date. It's a waste of money. You're making a circle. Before you freeze fat, right, change the nutritional life. That is harder, not as appealing, requires time and requires guided therapy through intellectual medicine or another specialist in this field. Drives me crazy. See people. This woman once came to see me. She had a body mass index above 40, which means that she had significant adiposity. She spent $10,000 on CoolSculpting. $10,000. What do you think she got for that? is you got a big dent in their bank account and little else. They did another study. They looked at liposuction, similar to CoolSculpting in that it's a targeted removal of fat in the absence of any kind of other intervention, right? You know what they found? The fat came back in another location. So when they sucked the fat out of the stomach, years later, months later, the fat came back only since the reservoir in the stomach was no longer available to deposit excess calories into. It came back in the arms. That's right. They got rid of that fat pad and the arms blew up. Crazy. We are so far behind in obesity treatment, it's going to take us 20 years to catch up. Diet and exercise for weight loss is a recipe for failure. It almost never works. You cannot jog off that fat. It's got to be treated. I got to get to all the stuff we get back. Blood pressure stuff too. 1 minute. All right. So we had the football team over last night for a little pasta dinner before the football game. Great fun seeing a bunch of high school kids just eating cheese and macaroni. Had a good time. Today they kick off at Johnston at 12. I'm very excited to be able to go there and watch it. It looks like the weather's going to be decent. Burrillville, very good team. It's kind of fun. The kids, they get to know each other because they go to camps in the summer, so you get to know your opponents a little bit. And isn't that really the essence of communication, is getting to know your opponents so that you can be vigorous opponents on the field and you can have common ground off of it. You know, we can learn a lot from athletes when it comes to how we interact with people that have different philosophies than our own. Bias is at its core a manifestation of ignorance. And there's enormous bias in different segments of our society, and there are biases in medicine. It's been said about medicine that doctors are like the mafia. They only kill their own. I'd say, here we go.
With Dr. Petteruti. Call in now at 438 WPRO or 1-800-321-WPRO.
All right, so we're back. And Tyler, the answer to the question is this. Your blood pressure is 155/98. This was the most compelling study. Now, this goes against recent changes in recommendations. So a recent recommendation came out declaring high blood pressure to be anything but the threshold used to be 140/90. They dropped it to like 130/80, somewhere around there, so that if your blood pressure was above that threshold, you needed to consider treatment. Well, at the time they did this, Shannon and I both were aghast. We realized they were opening up the floodgates to drug millions and millions of people, making billions of dollars for the drug companies at nearly no benefit to the humans. And we were right. A new study, 38,000 people. You know, they looked at folks with mildly elevated blood pressure. They described mildly elevated as 159/99. Mild. So if you had 155/98, you're in the mild category according to this study. If you were otherwise healthy, no other compelling risk factors, right? Means you haven't had a stroke, you're not a diabetic, you haven't had a heart attack in the past. You're basically, I'll portray myself, a 59-year-old guy with this mildly elevated blood pressure. You know what they found? Drugging it had zero health benefit. None, not even a little. No extension of life. No reduction in heart attacks. No reduction in any medical complication. None, zero. Drugs had no benefit. You know what else they found? They caused harm. Passing out, syncope, side effects, sexual dysfunction, headaches, dizziness. The beat goes on. Now, if you're listening to me speak and you recognize yourself in this description, don't quit the drug today. The bad things can happen when you suddenly abandon your drug therapy. Simply go back to your doctor and challenge them in a thoughtful manner. You can find this article, the Journal of the American Medical Association, blood pressure meds in low-risk patients found no benefit. You've got to have medical assertiveness nowadays in order to get what you want out of the system. And sometimes what we want is, please don't hurt me Don't give me drugs that are going to harm me. So we talked earlier in the show about getting multiple opinions. So I'll share with you a 65-year-old patient of mine with severe osteoarthritis of his knee, having trouble with pain, but still functioning pretty high level. He can walk, exercises, enjoys life. Went to several surgeons seeking opinions. Some of them said, you know what, it's time to get your knee replaced. Well, he went down to Florida, saw Dr. Roche, who's a world-renowned joint replacement surgeon. And folks, if you're thinking of something of this magnitude, it's worth traveling to get opinions that are difficult to come by. And after waiting months to get this opinion, the surgeon looked at him and said, listen, I can replace your knee, but what are you going to do in 10 years when it wears out? You're a young guy, you're only 65, right? So I'm loving this guy already because he's got it right. If you're 70, 75, you're young. Replace that knee, then what? He said, bad things can happen, complications can happen. And this is a guy that makes his living replacing knees. And he said, look, do what you can, go back to intellectual medicine, work on the weight, get your plasma injection into the knee, do everything you can to not have this knee replaced. What we know is when we put in metal and we take out, or plastic, and we take out organic tissue, your capacity to self-heal has been deterred. Every joint, every cell, every cut, every wound, every heart disease, every malady in your body is currently being addressed by your body's self-healing dynamic. Now, that self-healing dynamic may not be adequate. It may need some support. But you start cutting out tissue and putting in metal, you're replacing the organic tissue that can recover with junk, plastic. Well, it's the wintertime, right? The holidays are coming. Here's a study that I think has merit. You know, we've known for a long time that there's something called seasonal affective disorder. Seasonal depression, right? It gets dark. Get inside, you get cabin fever. 2 studies have pointed to high-dose vitamin D supplement helping to reduce depression. We're not sure exactly how this works or what the cause or the connection is, but there are studies that correlate depression with very low vitamin D levels. 25-hydroxy vitamin D is a test you want to have assessed. You want that level to be above 50, in my opinion, and that of many other functional and intellectual medicine doctors. If it's below 30, you got real problems. So what should you do about all this? Well, getting your level tested, maybe. I can tell you it's going to likely be low unless you're on a supplement. Why? It's New England, people. There's no sun. We cover our skin. We work indoors. It's dark out all the time. What amount is safe? It's widely agreed that even without a medical assessment, you can safely take 4,000 international units of vitamin D every day and not worry about taking too much. That's 4,000. I say to folks, are you taking vitamin D? Oh yeah, I'm taking it over the counter. Yep, it's 1,000 units. 1,000 units is fractional. Fractional. I've never seen anybody taking 1,000 units of vitamin D per day have a blood level when I test it that I deem to be ideal. Not a 1. So vitamin D in the winter, absolutely. Why not? Do the studies support it? Well, I told you we talk about evidence, right? It turns out that evidence is subjected to interpreter bias. What a shock. That science is not absolute and that the evidence depends on who's interpreting it. So they did a study to test this theory. What is evidence? They had several teams of analysts and they gave them the exact same data points. So picture this, right? Different teams of analysts, the exact same information to analyze. Absolutely no difference in the information. Would it shock you to know that they came up with different conclusions? And these were not people off the street, folks. These were scientists, people trained to analyze and interpret data. Different conclusions with the exact same data. It's a cautionary tale. And this is one of the reasons why science is subjective and changing. And that is in part because of interpretation biases. If there's a study performed on vitamin D And if the people that designed the study start the study with a philosophy that supplements really aren't that good, then the study will be designed in a manner and interpreted in a manner to reinforce that conclusion that they took into the study to begin with. Publication bias. A study that does not show a good outcome is likely to be buried and never published. Many studies have pharmaceutical drug money behind them. And they do a couple things. They bury studies that don't favor them, and they over-exaggerate studies that do. Intellectual medicine promotes the self-healing energy of your body. We promote the ability of you to maintain youthful energy. Unfortunately, and that's not unfortunate, we're happy about this, we have no sponsors. The things we promote, the essence of good health, does not lie in an FDA-approved, big pharmaceutical incorporated drug therapy. We're not disparaging the use of prescription drugs when they are critical and necessary. But I guarantee you, people, they're exaggerated. We're talking billions upon billions of dollars behind this industry. What do you think those billions are going to do to information that challenges them? Information that makes their great outcomes seem less stellar and that offer alternative pathways. You don't need to be a scientist to conclude that when billions of dollars are at stake, alterations in interpretation can happen and trusted sources can be compromised. Trusted sources like the American Cancer Society. Recently, their leader, their head, resigned, partly in response to his feeling that they were making unhealthy alliances with entities that were not in the public's best interest. Why did they do this? Well, it turns out that their money was drying up, right? They were averaging $1 billion a year of donations. They're down to $750 million. Do you know why? People are losing confidence. In part, so they took a $250,000 donation from Herbalife, the American Cancer Society, and they started to endorse, by virtue of mutual promotion, Herbalife. Hey, folks, we're not endorsing Herbalife. We're not endorsing anything. We're endorsing you. You are the captain of your ship. You have the right to assert yourself medically so that you can live, and we wish you, at Intellectual Medicine, 120 youthful years. Folks, see you next week. 120 youthful years, everybody. Hey, it's our birthright. We weren't born to passively get old, wrinkle up, and die. We were born to kick butt and take names right up until our last breath. And if that's not what you're feeling, then you got to ask yourself why. Do not accept mediocrity, people. A+ living, that's what we're aiming at. Thanks for tuning in. I'll see y'all next week.